Hello everyone. Today we discuss about the episiotomy and suturing cases in midwifery and gynecology case book. The first case, episiotomy and suturing case number 1. It include name of the hospital, name of mother, ward number, bed number, husband name, age, region, date of admission, time of admission, gravida, para, abortion, leaving, LMP, EDD, gestation week, housewife, address, cephalic ROA position in cephalic, 140 bm, indication of premigravida, phase 2, public, pubis, delivery, big baby, narrow pelvic arch, fatal distress, premature baby, nature of delivery, full term, normal, vaginal delivery, type of episiotomy, mediolateral type of episiotomy is done, episiotomy and suturing, use local infiltration with the lignocaine. There are no known allergen to lignocaine infiltrate beneath the vaginal mucosa. Skin, date of delivery of babies and time of delivery of baby, time of delivery of placenta, baby sex, birth weight, Apgar score, preparation of environment, ensure lighting and providing screening, check the requirement before start procedure, prepare operative, check doctor and ensure the woman consent to procedure, advise to mother ask mother to apply ice to the first 24 hour, take warm bath, will 24 after given, take medicine with ibuprofen to relieve pain, to concern doctor if fees and demonstrate. Second case. Hello everyone. Today discuss episiotomy and suturing case number third. Name of hospital, name of mother, ward number, bed number, husband name, age, religion, date of admission, time of admission, parity, para, abortion, leaving, LMP, EDD, gestation A, assessment report, cephalic ROA position in cephalic present 140 ppm, indication of episiotomy, nature of episiotomy, nature of delivery, type of episiotomy and suturing notes. Use local infiltration with the lignocaine. There are no known allergy to lignocaine. The vaginal mucosa beneath to date of delivery of baby, baby sex male, birth weight 3.5 of rate, prescription prescription of environment, ensure good lining and provide lack of requirement one before short procedure, preparation of patient, advice to mother, ask the mother to apply the ice, take warm bath before until second, to a doctor. Then come to the fourth case. Name of the hospital, name of mother, ward number, serial number, husband name, region, EDD, and gestation, address, assessment report, presentation, cephalic position, RA position, the cephalic, FHR 140, indication of the episode, perigravida phase 2, the pubis and delivery, and the big normal pelvis and the fetal disease, full term normal vaginal delivery, type of the episiotomy is done, Episiotomy and suturing notes use the local inflation with the lignocaine. There are no allergies. Is lignocaine inflated between the vagina mucosa beneath? The skin is perineum and different. Date of delivery of baby, time of delivery of placenta, baby sex and the baby weight of gar score, prescription of the, as previous I told, prescription of the environment, ensure good lighting, provide lack of requirement equipment before start the procedure, preparation of the lack of preparation of the patient and check doctor order, ensure the warm environment of the, ask the mother to apply ask torch in first 24 hour of the birth that swelling help until pain, take the warmth bath until 24 hour, take medication if free into doctor to any see. Episiotomy ne 5 case number, name of the hospital, civil hospital Ambala Kent, name of the mother, husband name, ward number, time of admission, parity, LMP, gestation age, presentation, position, indication of Premigravid phase 2, pubis per delivery, neurons and nature of the delivery, type of episiotomy and suturing, use the local inflating with lignocaine. These are non-allergy to inflate between the vaginal mucosa beneath, date of delivery of baby, baby sex, birth weight, upgar, preparation of the environment, good lighting condition and check equipment before the procedure, check the doctor prescription, advice to mother, environment, warm environment to the mother, medication ibuprofen to relieve the pain, assess the condition of the mother. Hope you get information from this video. Subscribe the channel for more video. Thank you.